Welcome back. We are answering your questions about the coronavirus with Cohn Health's Chief Physician Executive, Dr. Bruce Swords. Remember, you can text in your questions. The number's at the bottom of the screen. All right, this text question is, will Cohn be giving out less vaccines than they used to because of the vaccine clinic that is coming to Four Seasons?
We are not anticipating that. We think we will be allotted the same number of vaccines from the state as we would be if the mass vaccine clinic wasn't in our area.
All right, and this is a follow-up. Will Cohn Health continue to offer the Moderna vaccine, or will they switch to Johnson & Johnson?
We will give out whatever vaccines we get our hands on. And so the federal government and the state are responsible for allotting vaccines to providers, and we're committed to giving all of those vaccines, no matter which ones we get, because they're all effective.
And I think that sometimes people don't realize the distribution. It comes from the state. You don't get to ask what you get.
That's right. It's all allotted. The state has an algorithm. They follow it, and we're happy to get every vaccine we can get.
This person is asking, if I receive my first vaccine at one place, do I need to go to the same location to get my second shot?
It's easiest if you do that, and it's not necessary. We certainly have given the first shot to people knowing that they're going to move to Texas, and we have given second shots for people who have moved from California. It's easier to go to the same place, not a requirement.
This person is asking, how exactly do I get signed up for a vaccine?
Yeah, again, that's an it depends answer. From a Cohn Health point of view, certainly there are directions to sign up within Cohn Health at our website, cohnhealth.com, and there are other instructions on that website that will help you sign up with the county or with us. So that would be a great resource.
This person is asking, can a person be a carrier of COVID-19 after having received both shots?
It's another one of these, we really don't know answers. We do think that if someone who has been immunized is in contact with somebody who has COVID, perhaps briefly they could carry it. It might be somewhat unusual for them to then spread it, but we're quite convinced that the person who's been immunized has a very low chance of getting sick and almost a zero chance of being hospitalized and really sick.
This person is asking, if you take the vaccine, will you test positive for COVID?
Generally speaking, if you get a test where it's a nasal swab, the answer is no. If you were to get blood work looking for antibodies, the answer is likely yes. And so it depends on the test that you get and what someone's looking for.
Okay, so then if someone needed it to go back to work or something like that, would they get a different antibody test versus a COVID test, or?
Yeah, if someone's getting screened for work or an illness, they get the test that normally has been given, and that's the nasal swab, the PCR test, and it would be very unlikely for someone who's had the immunizations, both vaccines, to have a positive test.
Does the vaccine affect fertility for women who are trying to conceive?
Yeah, we don't think so. It hasn't been widely studied. There is now advice for women who are pregnant that there's no reason why they should avoid the vaccine, and there's no indications that it impacts fertility.
All right, we've got about 1 minute left. This person is asking, what are some reasons for people to not get the vaccine right now?
Yeah, I'm thinking hard here why someone may not get the vaccine. If you've recently had COVID, if you're within 30 or 45 days of having COVID, it would be reason to delay getting the immunization, but get the vaccine after that period of time. And the only other reason not to get the vaccine is if you're not in one of these phases outlined by the state.
Okay. And then we just had someone who said, I received my first vaccine and I can't find my card. My next one's scheduled for this day. Can they look up my info? You should call your provider who you got that first vaccine from and then be able to kind of work it through that way. All right. Thank you, Dr. Swords. Is there anything you wanted to add for that?
No, I think that's the right answer. And if you were to show up on the right day, you'll be taken care of.
All right. Thank you for texting in those questions. WFMY News 2 at 6 is coming up next.